Hello everyone, and welcome to another series of Case of the Month. This time we have a renal biopsy specimen from a 71-year-old female patient who is biopsied due to an acute increase in creatinine. The baseline levels of which was 0.9 and increased to 2.9 milligrams per deciliter. In her history, we know that she has been receiving treatment for ovarian cancer, recurrent ovarian cancer, for the past 5 years. And she also has severe proteinuria, and the clinician is suspicious of secondary membranous nephropathy when he sends the biopsy specimen. Now, this is the specimen. It's a biopsy of the cortex, as you can see. You can realize patchy areas of tubular atrophy and simplification. But what actually immediately draws our attention are the glomeruli. The glomeruli look too pink, and even from this magnification, you can appreciate that they look bloodless. And when we move in, you can again appreciate the severe edema present within this glomerulus. You can see that the there's subendothelial widening, and also, let me zoom in. Severe mesenteriolysis. You can make out double contours. And the basement membranes are thickened, and this is due to endothelial swelling. You can also make out fragmented red blood cells. Again, another glomerulus. It's got mesenteriolysis. It looks bloodless. That's due to severe, as I said, endothelial swelling. Over here, another glomerulus. There's mesenteriolysis, and you can see fragmented red blood cells. This one has an area which could be a thrombus. And again, as you can see, there's subendothelial widening due to severe edema. The endothelial cells are swollen. They kind of resemble the glomeruli you see with acute ischemic injury, like those in acute allograft nephropathy, and again those patients with thrombotic microangiopathy. But what's different is that these changes are global and diffuse. You can see that all of the glomeruli have similar changes. They're bloodless, they've got mesenteriolysis, severe edema of the... Now, as I said, because these changes, changes which resemble those seen in thrombotic microangiopathy and acute allograft glomerulopathy, that means severe diffuse global ischemia of these glomeruli, immediately made me question whether or not, and I knew that she had a history of ovarian cancer, this patient was receiving drugs targeting the vascular endothelial growth factor pathway. And it turned out that she really was, and the increase in creatinine was right after couple of maybe 1 or 2 weeks after initiation of anti-vascular endothelial growth factor antibody treatment. This is the silver stain. Again, it's very easy over here to appreciate the double contours, which are due to, as I said, endothelial swelling, widening of the subendothelial space. You can also see at the periphery here an area of small focus of thrombosis. Again, there maybe fibrin or thrombi within the capillary lumini, as you can see over here. And endothelia of the glomeruli are severely swelled. Mesangiolisis is also easy to appreciate. You can see that you can't make out the nice black mesangial area that you're supposed to be able to normally. You can appreciate how thick the basement membrane is and how the endothelial cells have swelled. And as I said, these changes are global and diffuse. Trichome stain revealed thrombi and fibrin, as you can see over here. And the tubules also, of course, showed acute tubular injury with shedding of tubular epithelial cells into the lumen, and again nuclear enlargement and vacuolization and edema of the tubular epithelial cells. But the most prominent changes, as I said, were within the glomeruli. Over here you can also see acute tubular injury, but the most prominent changes are within the glomeruli. And here again you can see an area, the hilar arterioli showing thrombotic microangiopathy. So this was a case of a patient receiving antivascular endothelial growth factor antibody treatment and therefore had diffuse acute ischemic injury of the glomeruli, which resulted not only in an increase in creatinine, but also nephrotic range proteinuria. So bye-bye, hope you enjoyed this case.